Opening a transitional shelter for its homeless waitlisters. The agency will hold a blessing on Monday for the federally funded $6.4 million.
Every city has familiar faces you stop noticing because they're always there. But in 2025, something strange is happening. The people who lived on these streets didn't move down the block. They didn't relocate. They didn't leave behind replacements. They're just gone. And no one can explain where they went. Across U.S. cities in 2025, a disturbing pattern keeps repeating. People who were visible every day suddenly aren't there anymore. This isn't seasonal movement or gradual relocation. Entire groups of unhoused individuals disappear within days. In Los Angeles, outreach workers report familiar encampments shrinking by 30 to 50% in under 2 weeks. In Phoenix and Las Vegas, areas that held dozens of people now sit completely empty, without anyone nearby to replace them. Usually, homelessness shifts from block to block. This time, it doesn't. What makes this truly alarming is the complete lack of continuity. When people move by choice, they reappear somewhere else, under another overpass, near a shelter intake point, or along a known service corridor. In 2025, observers aren't seeing that second step happen. The people aren't relocating locally, and no agencies can confirm where they actually went. The disappearance isn't loud or dramatic. It's quiet and gradual. Sidewalks look cleaner, but communities aren't healthier. Nationally, the U.S. has over 650,000 unhoused individuals according to federal estimates, but frontline workers argue the real number runs far higher because official counts miss people who actively avoid visibility. When even that visible population begins to vanish without explanation, the system loses its most basic tracking signal: physical presence. This represents the first major warning sign. When people disappear without any clear explanation, it means they're no longer anchored to any specific location, service provider, or tracking method. That makes everything else, healthcare access, personal safety, basic survival, exponentially more dangerous and uncertain. Cities frequently explain vanishing homelessness as natural movement, but that explanation completely breaks down under closer examination. Movement always leaves evidence behind. Outreach teams recognize familiar faces. Local businesses notice when regular individuals reappear nearby. Police activity logs document relocations and pattern changes. In 2025, those standard indicators are consistently missing. In multiple metropolitan areas, nonprofit organizations show data reflecting drops of 20 to 40% in known street populations without any corresponding increases in shelter occupancy, emergency room visits, or neighboring district populations. That distinction matters enormously. If people were simply shifting locations, those connected systems would show noticeable pressure spikes. Instead, shelters remain completely full, but aren't expanding capacity. Emergency room visits related to homelessness stay flat or show delayed patterns. Adjacent neighborhoods don't report sudden surges in unhoused populations. Movement also requires specific resources: transportation access, physical ability, and social connections. Over 35% of the unhoused population exceeds age 50, and nearly 30% report chronic medical conditions requiring ongoing care. These aren't people who can easily relocate long distances on foot without assistance. When individuals vanish without leaving any trace, movement becomes an insufficient explanation. Another critical red flag involves personal belongings. People living outside guard possessions intensely because they represent essential survival tools. When shopping carts, backpacks, and important documents remain abandoned, it signals sudden interruption, not voluntary choice. When standard explanations fail repeatedly across multiple cities, the fundamental question changes completely. It's no longer, why did they move? Instead, it becomes, what disrupted them so thoroughly that absolutely no trail was left behind? One major driver of sudden disappearance involves aggressive encampment removal operations. Cities typically describe these actions using terms like cleanups, abatements, or health interventions. But the actual outcomes tell a dramatically different story. During 2024 to 2025, large cities increased sweep frequency by 15 to 25%, often citing public safety concerns or sanitation issues as primary justification. An encampment represents far more than just clustered tents. It functions as a fragile but essential survival network. People share phone chargers, actively protect each other's belongings, monitor medical conditions requiring attention, and exchange critical information about food access, clinic locations, and available work opportunities. When a sweep occurs, that entire support structure collapses instantly and completely. People are forced to relocate under extreme time pressure, often receiving only minutes' notice before removal. The result isn't organized relocation, it's complete fragmentation. Some people successfully reach available shelters. Many others don't make it. Others scatter into wooded areas, industrial zones, flood control channels, or parking structures where visibility drops sharply and dramatically. Studies consistently show that after encampment sweeps occur, up to 70% of displaced individuals are never contacted again by outreach teams attempting follow-up. From a city government's perspective, the encampment successfully disappears, creating a convenient illusion of progress. From a data collection perspective, people fall completely out of established tracking systems. Scattering makes homelessness significantly less visible, but exponentially more dangerous for affected individuals. It increases social isolation, overdose risk, medical emergency likelihood, and vulnerability to exploitation by bad actors. Among people living outside, belongings literally represent life itself. A backpack may contain identification documents, medical records, essential medications, and everything needed to survive another night safely. A shopping cart isn't clutter. It's a mobile home containing every possession someone owns. That's precisely why abandoned belongings serve as such powerful warning signs that something went seriously wrong. Outreach workers consistently report seeing intact shopping carts, neatly folded blankets, and prescription medications left behind immediately following sweeps or sudden removal operations. This matters tremendously because people absolutely do not abandon these items voluntarily under normal circumstances. Research clearly shows over 60% of unhoused individuals have previously had belongings confiscated or deliberately destroyed by authorities, making them hyper-protective of whatever remains in their possession. When belongings get left behind, it typically means one of four specific things occurred: sudden hospitalization, unexpected arrest, forced displacement, or death. None of those represent benign explanations for absence. Yet cities often officially classify these abandoned items as simple trash within hours, effectively erasing the last physical evidence proving someone actually existed there. The loss of belongings also resets a person's survival clock completely back to zero. Without valid IDs, accessing shelters, government benefits, or basic medical care becomes nearly impossible. Replacing official documents can require months of bureaucratic processes and demands mailing addresses homeless people simply don't have available. Abandoned belongings aren't random mess. They're interruption markers signaling lives disrupted faster than people could possibly adapt. When these markers multiply rapidly across a city, they're telling a story government officials consistently prefer not to read or acknowledge publicly. The most common response to disappearance remains the simplest and the least accurate. They obviously went to a shelter. In reality, shelters represent one of the biggest systemic bottlenecks. Nationwide, emergency shelters operate near 95% capacity continuously, and many facilities turn desperate people away nightly due to space limitations. Shelters also impose significant barriers to entry. Strict curfews conflict directly with night shift work and day labor opportunities. Many facilities require valid IDs, which over 20% of unhoused individuals completely lack. Pets are typically banned entirely, forcing people into impossible choices between personal safety and companionship. Couples are frequently separated by gender-based housing rules. Length of stay limits automatically push people back onto streets after weeks or months, regardless of circumstances. Personal safety represents another major concern. Surveys consistently show a significant portion of unhoused women actively avoid shelters due to documented assault risks. People living with mental illness often find shelter environments overwhelming and psychologically destabilizing. Theft inside shelter facilities occurs commonly, reinforcing deep distrust of the system. Even when shelter beds technically exist, access involves navigating complex bureaucracy, wait lists, mandatory intake calls, referral systems, and missed appointments can remove someone from eligibility consideration instantly. A dead cell phone or single missed voicemail can end the entire process permanently. So when people vanish from public view, it's rarely because shelters absorb them smoothly into safety. More often, they attempted entry, failed for various reasons, and slipped into deeper invisibility. The shelter system doesn't adequately explain disappearance. It often directly accelerates it by creating additional barriers rather than solutions. Medical crises represent one of the most common ways unhoused people vanish without any warning. In 2025, emergency departments across major U.S. cities report record numbers of unhoused patient admissions, driven primarily by overdoses, untreated infections, extreme heat exposure, and chronic illnesses that went completely unmanaged. When someone gets taken by ambulance, they frequently arrive without any identification documents. They may be registered under temporary names or simply listed as unknown patient. Once formally admitted, that person effectively disappears from street view completely. They can be sedated for treatment, transferred between different facilities, or placed on extended medical holds. Hospitals remain bound by strict privacy laws, meaning even outreach workers who personally know the person by face cannot legally confirm their presence or condition. Street communities don't know where to ask for information. Hospital staff doesn't know who might be asking questions. The average hospital stay for an unhoused patient runs 2 to 3 days longer than for housed patients due to complicated discharge planning. During that extended time, belongings left behind on sidewalks are often confiscated or discarded during encampment removal operations. When patients finally get released, it's frequently without transportation assistance, housing placement, or any connection back to outreach teams who knew them. Some patients are discharged late at night. Some get transferred miles away to different facilities. Some leave against medical advice because they fear losing their spot or remaining possessions. From the outside looking in, it looks exactly like disappearance. From inside the healthcare system, it's considered completely routine procedure without any follow-through. Mental health interventions represent another major driver of unexplained disappearance. In 2025, involuntary psychiatric holds increased sharply as cities increasingly leaned on crisis response instead of actual housing solutions. These holds can legally last 72 hours or extend far longer, depending on clinical evaluations, facility staffing levels, and bed availability constraints. When someone gets placed on a psychiatric hold, they're removed instantly from public space without warning. They may be transported across county lines to reach available facilities. Names can be recorded incorrectly in admission systems. Personal cell phones are often confiscated for safety protocols. Contact with the outside world may be severely limited or completely non-existent during treatment. For street communities, this creates a total information blackout. No one knows where the person went. Outreach teams are rarely notified about holds. Hospitals and psychiatric facilities cannot legally confirm patient details. Even after eventual release, individuals may be dropped off far from their original location with absolutely no resources or support. Data clearly shows that over 40% of unhoused individuals live with untreated mental illness. That makes them disproportionately vulnerable to repeated involuntary holds. Each hold increases the chance they lose belongings, social connections, and geographic anchors to familiar areas. This cycle makes people progressively harder to locate each time it repeats. A person may return weeks later visibly disoriented, fundamentally changed, or completely unwilling to discuss what happened. Others never return at all to familiar areas. The disappearance isn't dramatic or sudden, but it's deeply destabilizing, cumulative over time, and profoundly damaging to already fragile stability. Each hold erases another piece of continuity from disrupted lives. Another quiet pathway to disappearance involves the criminal justice system. Trespassing charges, loitering violations, illegal camping citations, and minor outstanding warrants all disproportionately impact unhoused individuals. In cities that significantly increased enforcement during 2024 to 2025, citations for homelessness-related offenses rose by 20 to 30% compared to previous years. Arrest doesn't require any serious crime. Being physically present during an encampment sweep, refusing to move quickly enough, or sleeping in legally restricted areas can all lead to immediate detention. Once jailed, people may be held for days or weeks over relatively minor charges they cannot resolve due to missed court dates or unpaid fines they cannot afford. Release rarely returns people to where they were originally taken from. Many are released without their belongings, which were confiscated or discarded. Some are legally banned from returning to specific geographic zones. Others choose not to return because the area now feels hostile or unsafe. From the street level, the person simply vanishes without explanation. No notice, no forwarding information. Their belongings may already be gone. Their social circle moves on out of survival necessity. National studies show that over 25% of unhoused individuals cycle through jails annually, often for low-level offenses tied directly to survival behaviors like sleeping or existing in public spaces. Jail doesn't solve homelessness, it scrambles it completely. Each cycle increases invisibility. Each release weakens continuity. Over time, people disappear not because they committed serious crimes, but because survival itself has been systematically criminalized through policy. The system creates disappearance through punishment rather than support. Some disappearances result directly from relocation programs that move people out of sight rather than into genuine stability. Cities and nonprofit organizations often offer one-way bus or plane tickets to supposedly reunite people with family or send them where services are reportedly available. In theory, this approach can be genuinely helpful. In practice, it's often unstable and poorly tracked. In 2025, thousands of unhoused individuals accepted relocation assistance offers. But follow-up tracking is extremely rare. Once someone leaves city limits, they vanish completely from local data systems. If the destination fails, no housing, no family support, no promised services, they're stranded in unfamiliar territory. Research shows that over 30% of relocated individuals return to homelessness within months, often in unfamiliar cities where outreach teams don't know them. Shame, cost, and logistics prevent many from returning to their original location. To the city that sent them, the person is gone. To the public, homelessness appears reduced. In reality, it has simply been exported elsewhere. There are also unregulated offers, promises of treatment, work, or housing that collapse on arrival. When people are desperate, they take risks. Some step into vehicles believing they're moving towards safety. Others never reconnect with the people who knew them. Relocation explains some disappearances, but it also creates a new class of invisible homelessness that no city claims responsibility for tracking. People become statistically invisible while remaining desperately unhoused. The problem isn't solved, just relocated beyond local accountability measures and reporting requirements. The darkest explanation is also the most uncomfortable. Some people vanish because they die unnoticed. In 2025, overdose deaths among unhoused individuals remain disproportionately high. Exposure deaths from extreme heat and cold continue to rise steadily. Untreated infections and chronic conditions turn fatal without consistent medical care. When a housed person dies, alarms go off immediately. Employers call. Family notices absence. Neighbors ask questions. When an unhoused person dies, the first sign is often simple absence. Their usual spot is empty. Someone assumes they moved. Deaths can occur in tents, wooded areas, abandoned buildings, or industrial zones, places specifically designed to avoid public attention. Bodies may not be discovered for days or weeks. Belongings are removed before anyone connects the dots. By the time a death is officially recorded, it's separated from the street community that recognized the person as a human being. The disappearance comes first. The explanation comes later, if at all. This reality isn't rare. It's structural. And it fuels fear because if death can look like vanishing, then vanishing can hide far more than people want to admit. When someone disappears from the streets, their absence can mean many things. Death is one. But because death looks identical to relocation, hospitalization, or incarceration from outside view, the uncertainty persists. Street communities live with constant not knowing. Someone is gone. No one knows why. No one knows where. And eventually, asking becomes too painful. This is how death becomes normalized as just another form of disappearance in communities already experiencing constant disruption. When people vanish from public view, exploitation becomes significantly easier. Unhoused individuals are prime targets because they lack documentation, witnesses, and reliable ways to report abuse. In 2025, outreach organizations report rising cases of unpaid labor, coercion, and document theft tied to informal work offers. Labor exploitation often looks completely ordinary. Someone offers a few nights of shelter or food in exchange for work. Payment is delayed, reduced, or never delivered. Without contracts, IDs, or legal leverage, victims have no recourse. Once exploited, many move away quietly to avoid retaliation, effectively disappearing from familiar areas. Theft paired with violence is another driver. Stealing phones, IDs, or medications traps people in deeper invisibility. Without identification, accessing shelters, benefits, or medical care becomes nearly impossible. Replacing documents can take months and requires mailing addresses people don't have. Human trafficking is rare but real. Federal data confirms traffickers disproportionately target people without stable housing. Isolation, addiction, and mental illness increase vulnerability. Most cases are never reported because victims fear arrest, disbelief, or further harm. What makes exploitation powerful is silence. When someone disappears due to abuse, there's often no report, no record, no follow-up. The absence is absorbed into the background. This doesn't require a conspiracy, only vulnerability and a lack of accountability. Disappearance becomes a shield for harm. When no one is watching, when no one is tracking, when no one is asking questions, bad actors operate freely. The most vulnerable people become even more vulnerable once they vanish from public view. Many people notice a contradiction. Cities report homelessness stabilizing or declining, yet street-level suffering feels worse. This disconnect comes from how homelessness is counted. Most official data relies on point-in-time counts, conducted once a year or less. These counts capture who is visible during a narrow window. But in 2025, visibility itself has become dangerous. Increased enforcement pushes people into cars, woods, industrial zones, or abandoned buildings, places intentionally chosen to avoid detection. People cycling through hospitals, jails, psychiatric units, or temporary stays with friends may not be counted at all. Someone can experience homelessness for months and never appear in official data if they aren't visible on count night. Cities can also reduce visible homelessness without reducing homelessness itself. When encampments are removed, tents disappear. People scatter. The metric improves. The problem does not. Studies show point-in-time counts can miss 20 to 40% of the unhoused population, especially those living in vehicles or hidden areas. The more homelessness is punished, the less accurate counting becomes. This is how people vanish statistically before they vanish physically. Numbers improve, reality deteriorates, and policy decisions are made using data that reflects visibility, not survival. When success is measured by absence rather than outcomes, the incentive becomes making people disappear rather than helping them. Cleaner streets don't mean housed people, they mean hidden people. And hidden people can't be counted, helped, or protected. The statistics look better while actual human suffering increases, creating a dangerous feedback loop where policy rewards invisibility. One reason disappearance persists is that systems touching unhoused lives rarely communicate effectively. Outreach teams, shelters, hospitals, jails, and nonprofits operate in parallel, not as a network. Each sees a fragment of the person. No one sees the whole path. A person may be removed from an encampment, hospitalized, transferred, released, cited, relocated, and re-hospitalized without any system flagging them as missing. Each interaction resets the clock. Each handoff loses context. There is no universal process for reporting missing unhoused individuals. Many jurisdictions require full legal names, dates of birth, or last known addresses, information that street communities often don't have. Without paperwork, concern never becomes a case. Outreach workers keep informal notes. Nonprofits track limited data, but these efforts are underfunded and disconnected. When staff turnover occurs, knowledge disappears with them. This fragmentation creates a black hole effect. People don't just fall through cracks, they move through corridors that never intersect. When someone doesn't reappear, no alarm triggers because no system feels ownership. Disappearance isn't caused by one failure. It's caused by many small failures aligning. And once aligned, reversing them becomes extremely difficult. The solution would require data sharing, coordinated tracking, and accountability. But those require funding, political will, and acknowledging that people are being lost. Without those commitments, fragmentation continues. Each system can claim it did its job. The person was housed, treated, released, or relocated. What happened next isn't their responsibility. And in that gap between responsibilities, people disappear permanently without anyone feeling accountable. As enforcement increases, invisibility becomes protection. Many unhoused individuals deliberately withdraw from visible areas to avoid sweeps, citations, or violence. In 2025, vehicle dwelling and hidden camping increased sharply as public spaces became hostile. People move into flood channels, wooded ravines, construction zones, and abandoned structures. These locations reduce interaction, but also eliminate access to help. Outreach teams rarely enter these areas. Emergency response times increase. Witnesses disappear. Living unseen increases risk. Overdoses go unnoticed. Medical emergencies go untreated. Fires spread faster. Violence is less likely to be interrupted. Yet for many, invisibility feels safer than visibility. Vehicle dwellers face a similar dilemma. Parking restrictions push them farther from services. Frequent moves break continuity. Missed appointments pile up. Over time, people stop trying to reconnect. This shift explains why people feel homelessness is vanishing when it's actually retreating. The population hasn't decreased. It's gone underground. When invisibility becomes the safest option, society loses its ability to respond. You can't help who you can't see, and you can't count what is actively hiding to survive. The tragedy is that this invisibility is strategic. People aren't hiding from help, they're hiding from harm. But in hiding from harm, they also hide from help. The systems that could support them can't find them. The enforcement that drove them underground continues unaware, and the cycle deepens. This is disappearance by design. Not conspiracy, but consequence. When visibility is punished, people vanish. And once vanished, they're exponentially harder to reach, help, or count. If cities truly wanted to answer, where did they go? They would measure outcomes, not appearances. That means tracking what happens to people after sweeps, hospitalizations, citations, and relocations. Accountability would require coordinated data sharing that respects privacy while preventing disappearance. It would require missing person protocols that don't demand paperwork unhoused people cannot provide. It would require follow-up, not just removal. Success wouldn't be defined by cleaner sidewalks. It would be defined by fewer people cycling through emergency rooms, jails, and streets. It would track how many reached housing, treatment, or stable support, and how many simply scattered. Some communities attempt this quietly. Outreach teams keep informal missing lists. Nonprofits compare notes. Volunteers search for familiar faces. These efforts reveal patterns official systems miss. But without funding and political will, these efforts remain fragile. Disappearance continues because no metric penalizes it. When no one is held responsible for where people end up, the easiest outcome is silence. Real accountability would mean cities couldn't claim success without proof of positive outcomes. It would mean tracking people across systems. It would mean admitting when people are lost. It would require naming the problem. People are disappearing, not relocating. They're scattering, not stabilizing. And until systems track what actually happens after removal, they're participating in disappearance by neglect. The tools exist. The question is whether there's political will to use them. Because accountability exposes failure, and failure demands change. As long as disappearance remains undocumented, it remains consequence-free. The greatest risk isn't that people vanish. It's that their vanishing becomes normal. When absence stops triggering questions, disappearance becomes policy by neglect. Undocumented disappearance allows every explanation to coexist. Relocation, shelter, jail, hospital, death, without verification. That ambiguity protects systems from scrutiny while people fall through unseen. History shows that populations treated as background noise are the easiest to lose track of. Once documentation stops, accountability dissolves. Once accountability dissolves, harm accelerates. The solution isn't panic or conspiracy, it's attention. Patterns only emerge when people compare what they see. When cities, outreach workers, and residents notice the same thing independently, that's data. If people are vanishing across cities at the same time, under the same pressures, the question isn't, where did they go? The question is, what conditions made disappearance possible? Because disappearance doesn't happen in a vacuum. It happens when visibility is punished, systems are fragmented, and survival itself becomes criminal. And once that becomes normal, anyone without power becomes easier to lose. This is why documentation matters. This is why tracking matters. This is why asking, where did they go, matters. Because the answer reveals how a society treats its most vulnerable people. When people disappear without documentation, without investigation, without consequence, It means a society has decided certain lives don't merit tracking, and that decision, once normalized, becomes nearly impossible to reverse. The vanishing continues, the question stops being asked, and people become disposable through systematic indifference rather than deliberate cruelty. People don't just disappear without leaving ripples, unless no one is forced to look. If you've noticed familiar faces vanish where you live, comment your city and what changed first. And watch our next video